asanas, what is your opinion on pranayama uh, to reverse or to manage? Because there's a lot of conversation which is about nitrous oxide
Yes.
and how a certain like just doing pranayama
Right.
or Anulom Vilom
Yeah.
energizes it, and so
Like if you have blood pressure issues, one, Ayurveda can reverse it within just a span of 2 months. It's not a big deal.
2 months.
2 months,
Wow.
absolutely. Uh, we recommend Anulom Vilom to anyone who has sudden spike in blood pressures to immediately do Anulom Vilom as we know it, and instantly the blood pressure goes down. Of course, that's not a cure. For that, you need to, give medicines for the brain as well, and medicines so that the stress level in the body reduces. When it comes to cancers also or autoimmunes, we give something called as Kumbhak. That is a brilliant form of pranayam, which can really, in fact, one of our Vaidyas has, done a research on this Kumbhak and how it works on cancer patients and autoimmune patients. And it really can help in reversing and facilitates the body to be able to detox, which is, it's easier for the body to detox when you do a pranayam, because, very few people know that even you don't lose weight actually by sweating. You lose weight by breathing through breath.
Yeah.
Yeah, very few people know that.
Fat is burnt in the lungs.
Exactly, fat is burnt in the lungs, not in the not by removing the water content of your body.
And the reason why people run or walk is actually to get more oxygen into the lungs,
That's
so that
right. That's right.
so there's more fat burning.
Exactly.
But a lot of people don't.
Exactly.
But let's talk about the. Is there any caution which one should have in pranayam?
Yes, yes, very good question again. We speak to a lot of our patients we do get patients who come to us with, who've done a lot of kriya or who've done a lot of pranayamas, and they have psychological issues, or they do have mild forms of schizophrenia. So when you are controlling your pran, basically what is pranayam? You are controlling your pran. So when you're controlling your prana, you have to be very careful, and you have to learn it from a professional who really knows you and knows how to, you shouldn't be like Abhimanyu, where you know how to go in but you don't know how to come out of it. Yeah, so you have to be able to just control it and do it in a balanced way. You don't need to overdo it. Overdoing anything will cause harm. So even pranayama, overdoing it also will cause harm. So we suggest that you do 5 to 10 minutes of pranayama. That's more than enough, and Kumbhak is good enough for 5-10 minutes. Anulom Vilom also can be done for 5 minutes, perfectly fine. Yogasanas can be done for half an hour, 40 minutes. You don't need to work out too much to be able to lose weight or to kickstart your metabolism or to improve your health, for that matter.
So in your clinic, they also look at yogasanas and yoga?
Yes. So Karan, when we treat a patient, first of all, Ayurveda is incomplete without yogasana. So when we treat a patient, we have to give them a lifestyle change, basically dinacharya. We have to give them a dietary change, which we start with a Langan diet, and then make sure that they avoid certain kinds of food in case, like for example, dahi. I would want to say this on this podcast, that a lot of people think dahi is very healthy. Dahi is not healthy. In fact, Ayurveda says dahi causes abhishandi, which means that it chokes the channels and it causes tumors. So dahi is applicable only down south, where you have very hot weather. There, a little bit of dahi works, and mind you, down south, the traditional way of making dahi rice is by putting chalk in it. That works. That cuts off the chemistry of the dahi, which is basically sticky in nature. So that is something which I wanted to talk about. Now coming to your question, sorry,
about the cautions of pranayama and how you incorporate into your
Right.
yeah.
Then the third one is medicines. Of course, we give adaptogenic medicines. Most of our medicines are obviously herbominerals, and fourth is yoga and pranayama. Fifth is panchakarmas, wherein we detox the organism. Like there are several methodologies of doing that based on which panchakarma suits which patient. And five, which no one does, I can guarantee, is which is called as Achar Rasayan. Now, Achar Rasayan is behavioral therapy. We actually give a document to every patient where we talk about what kinds of behavioral issues they need to change or alter, or we just give them a document, say that just follow this and tick mark and incorporate this in your life.